We've got one more person coming. Okay, well, thank you very much for coming along this Sunday afternoon so I can give an update. First off, I'd like to thank all of those people in Queensland who've come forward over the last 24 hours, indeed the last week and the last months, to get themselves tested. That is the most important thing we can all do to protect ourselves, our families, our communities. If we have any symptoms at all, please just get tested and isolate till you get a result. And I'm also asking that anyone who's been in Victoria from 21 December onwards to come forward and get tested, whether or not they've got symptoms, and isolate themselves till they've got a result, just so we can catch that very, very first case. It's so important because we've now gone 110 days in Queensland without any community-acquired case in Queensland, and we've gone 17 days since we've had someone who was infectious in the Queensland community, and that person was the person who came up from New South Wales and were fantastic in how they managed themselves, and clearly we've not had any ongoing spread that we're aware of, so that's really good. So it is just important that people keep on testing. So some figures for today: we've had no new cases in Queensland in the last 24 hours, which is excellent, but we are continuing to see positive cases, not today, but in the last few days in our quarantine hotels, and they're very important in terms of keeping the virus out of the community in Queensland, which means we've now got 13 active cases in Queensland, 7 of them in the Gold Coast, 5 in Brisbane and 1 in the Sunshine Coast, and we now have 1,255 people who have acquired this infection in Queensland since it started. Today is 1 year to the day when I was first told about a potential new virus circulating in China. So yesterday we did 2,742 tests in Queensland, and over the last 7 days we've done 15,341, which is just a marvellous effort. We had 76 fever clinics open across Queensland yesterday, with 18 in the southeast corner of the state. We are opening more fever clinics and we're extending hours because of that rapid response from people coming forward to get tested after hearing that information, that I'd like people who've been in Victoria to come forward and get tested. So that is excellent. I would ask people, please go online. We've got a website that's continually updated with information about testing clinics across the state. It's interactive, so people can find their nearest clinic and they can find alternatives. So if one clinic is particularly busy, look at where else you can go in your area. And I do thank people for waiting for quite a while in some cases to get tested. So the other place people can go, of course, if they can't manage that website, is they can ring 13 Health and get information about their closest testing clinics. Now, we do have those restrictions currently in place for Greater Sydney, and we'll be reviewing them in the next week or so, depending how things go. Things are starting to settle there, which is really good news. So today they had another number of cases, but all were linked to their known outbreaks. And they haven't had any extension of infection outside that Greater Sydney area. So at the moment, all of their transmission events have occurred within that Greater Sydney, which includes Wollongong, the Blue Mountains and the Central Coast and Greater Sydney, but they haven't had further extension. And they're doing a lot of testing of sewage outside Greater Sydney, and that's all tested negative for COVID-19 today, which is all very, very reassuring. Victoria, similarly, there's been some reassuring information come out of Victoria. So in the last 24 hours, they had 3 new cases that they identified, and so far they've had 13 cases related to that super spreader event in the Thai restaurant in the Black Rock area of the Bayside in Melbourne. Then they've had an additional 8 cases, but all of those have been in household contacts linked to those 13 cases. So that is very good news that those cases are all closely linked at this stage. So at this stage, we don't need to extend any border restrictions to Melbourne or to Victoria, but we're keeping a very, very close eye on that. And I meet with my colleagues from around the country every single day so that we can discuss what's happening in other jurisdictions and share all that information. So at this stage, there is no need to extend any border restrictions beyond those ones for Greater Sydney that are currently in place. We do need to be alert though, and things could, unfortunately, I definitely hope not, but things could unfortunately rapidly change. So I would ask anyone from Queensland who is planning on travelling down to regional New South Wales or to Victoria to keep a very, very close eye on what is happening and be prepared to rapidly return if that's necessary. Those border arrangements have kept Queensland safe now for nearly that year since they've been introduced, and we won't hesitate to use them again when they're required. So I just want to alert people just to keep very, very close eye on what's going on in both New South Wales and Victoria in case things change. But at this point in time, the signs are looking good. Now, one last thing that I have asked to be done, and I do thank our aged care facilities, our disability accommodation facilities, and our prisons and our hospitals for the work they've done with me in the past and continue to do. I have asked that all of those facilities limit any visits from people who've been in Victoria since the 21st of December, just so that we can keep our most vulnerable people safe while we just work through what is continuing to happen in Victoria. So I hope that those people, anyone who's come up from Victoria, has had a chance already to see their loved ones in those facilities. But I would ask that as of 1 a.m. tomorrow morning, that people who've been in Victoria since that 21 December date, please don't visit any of those vulnerable facilities. That's important so we protect those residents. Thank you, and I'm very happy to take questions.
Those new clinics, where are they opening up and what sort of extended hours will be?
The best thing, because there's 76 clinics already and we're opening up additional ones, the best thing is to go on the website. That's the most up-to-date information, and you'll have there all of the information about all of the clinics throughout the state. If there's some reason you can't access that website, just you don't have internet connection or you don't know how to use that website, then please ring 13 Health and get advice from them. But there are clinics throughout the state and they're all looking at the demand and whether or not they need to extend the hours and whether or not they need to bring in more staff.
So the situation at RBH last night where it was shut at 9 p.m. and people had to go home and not get tested, can you walk us through what happened there and if RBH is going to extend their hours as well?
Yes, so RBH worked with those people who couldn't get tested and sorted for them to be tested this morning. And they've continued to look at their resourcing and looking at those clinics. But there are a lot of other clinics. So I think a lot of people just picked a few clinics instead of looking at all of the clinics that are available. So I would suggest to people go and look at the 76 clinics, and more are being added as we speak, and look at a variety of clinics.
Will Queensland Health be doing anything at airports to make sure the messaging is getting through to arrivals from Victoria? Because when we were there this morning, quite a lot of them said they hadn't heard about these restrictions, or they weren't taking it seriously, they wouldn't do it.
Yep, so we've asked for manifests of all the flights from Victoria, and we'll be texting people, the same as we've done each other time that we've had a similar issue.
Just with the advice to Victorian travellers, is this they should get tested, or is it something that will be enforced over the coming days?
At this stage, I'm just asking them to please get tested. Anyone that we know is a particular risk, because we're working continuously with the Victorian health authorities, anyone we know to be a particular risk, we're working with them to make sure they get tested. So we did have someone who returned and was a close contact of a known case, a known venue in Victoria, and they returned home to Mackay. So we've worked with them, we've got them tested, they're negative, and they're now in quarantine for 14 days from when they left. So anyone we know who is a close contact or even a casual contact, we're working with them to absolutely get tested. I'm just asking other people to come forward. Of course, anyone who has any symptoms anywhere in Queensland, no matter where you've been, should definitely come forward.
Doctor, people have been giving up and leaving these testing lines. Is that a failure on behalf of Queensland?
We've stood up more clinics and we've extended hours, and we've worked with people who've come along to those clinics to get them tested. We do have those 76 clinics, so I would stress that people look around for other clinics. There are 76 clinics across the state, 18 in southeast Queensland. So I would prefer that people, instead of all going to one clinic, go to one of the other clinics.
And why is testing being under capacity during the holiday period?
It's not under capacity. We've got 76 clinics open throughout the state. They've been open throughout the period, and people have been coming forward and getting tested. I've spoken to my colleague at the Commonwealth, and they're going to reopen some of their clinics earlier than they had planned to after the Christmas New Year break. I'm very grateful to them. So the public sector did stand up more capacity because other sectors such as GPs and the private sector had withdrawn a little bit, so they're now coming forward again. So I believe there is plenty of testing capacity throughout the state. People just need to look around for it.
And there were reports that staff at the RBWH weren't aware of the changes that were announced yesterday, which could have led to that backlog. Are you aware of that? Is that what happened?
Their managers were aware, and they put in place extra processes. So the message mightn't have got down to the staff in the clinic, and that's understandable, but they're there to do that job. They're there. It's more about bringing more staff in from outside, which is what their managers were doing.
And there was talk this morning from people who had been online last night that they went to the RBWH because it was the only one that had late night testing.
That's
the
true.
only one open till 9 p.m. Is that why not everyone got to be tested last night?
Yes, so a lot of other clinics now have extended their hours.
Dr. Young, just on that, how much is a concern for you to hear people kind of go, oh, the line's too long, let's just go home? Because that's where people would slip through.
Exactly. That's why I'm here this afternoon, and that's why I'm so grateful to all of you being here this afternoon, so I can get the message out that we have a lot of testing capacity out there. It's just that we mightn't always have enough in one particular site, because those sites are limited by the size of the numbers of people who can come. So that's why I'm saying, please, could people look around and go to other sites? Don't just pick one or two, which is what we saw yesterday. It's really important that people go online and look at where there are other testing sites and use them.
Are you happy with the testing rates at the moment? Because from the amount of tests that happened on Friday to Saturday, over the 20, there was actually a decline in the rate of testing. So are you happy with how it is at the moment?
I can understand why there was a decline. We were very much in a holiday period. We've come out of that. So I'd ask that everyone return to getting tested. As we saw before the Christmas New Year holiday period, people were very active at coming forward and being tested, and I'm sure that will happen again. So it's really important. The most important people to get tested is anyone with any symptoms. That's critical. And then I would also ask people who've been down in Melbourne.
What are our quarantine details for our cricketers and for the Indians?
Yes, so we're working with Cricket Australia to finalise those arrangements. We've had a lot of discussions with them. They've been very useful, and I think we're very close to finalising the arrangements.
So when do you think we'll get a decision? When do you think the arrangements will be finalised?
That will be up to Cricket Australia. So we've almost completed the work to sign off their protocol, which was very thorough, very appropriate, and then they'll then have to decide what they do after that.
And are they a bit more lax than, so we heard that there would be a very strict bubble. Have there been considerations to relax that a bit?
No, we've been quite firm that, of course, we need to put in place firm arrangements, and Cricket Australia fully understands that, because these are people who are coming from Sydney, and we are seeing, as late as yesterday, an unlinked case in Sydney. So there is clearly transmission happening in the community down there, so we do need to have those firm arrangements in place.
Is keeping Queensland safe from COVID-19 more important than, I guess, is it worth risking losing this cricket match?
I think the cricket match can go ahead with the proposal that Cricket Australia has put to us and with the protocols that we have in place. I've got no concern about the match going ahead as we've been working through the details that they've put forward.
Initially they went to Sydney, but they decided to do that first test, like they've gone to the place where COVID's, exploding at the moment, and yet they're going to, come here after that. That was probably the risk.
No, that's a decision they've made, and I'm fine with the results of what will happen when they come to Queensland. Perhaps if they'd gone somewhere else, they wouldn't have to quarantine when they came to Queensland. But that's a decision that I think they've made, and they have their reasons. I'm very, very happy to work with them.
Just on the border messaging, obviously we told people if you want them to come back or don't go down to Victoria or Sydney. Is that any indication at all that you are in the back of your mind potentially thinking about closing the borders?
No, it's not. I'm just, because we've all been doing this for 1 year now, I'm sure everyone can understand what can happen. And so I'm just alerting people that if they do go down to regional New South Wales or Victoria, they may end up having to quarantine when they come back if they haven't kept alert. So I know myself, when I go on holidays, I tend to turn off from the media and not really know what's happening, just have a great time with family and friends. I'm saying this is not the time to do that. Now is the time to just keep engaged. So if you travel down to New South Wales or Victoria, just keep engaged and know what is happening and what decisions are being made, so that you're not caught unawares when you come back to Queensland if something has changed.
Doctor, just back on the cricket quickly, sorry, will they be confined to their rooms?
They'll be confined to the hotel, so we've worked with them that they can have bubbles within that hotel, because they're going to be going and playing with colleagues in the matches, so they're going to have exposure there, so it doesn't concern me if they have exposure to one another in the hotel. So that's absolutely fine. But they can't leave the hotel and they can't go out into the general community.
After seeing those pictures, after seeing those pictures of the Indians, some of the Indians with the team out for dinner, can they be trusted?
I believe that the situation that Cricket Australia has put forward in terms of having a cricket hotel and no one can leave that hotel other than to go to the Gabba to train or to play matches, I don't think we'll have that risk occur in Queensland.
Doctor, just to go back to the communication to Queensland hospitals, was it poor management from management staff to not let staff on the ground know that potentially there could be an influx of people to get tested with return from Victoria? Is that concerning at all?
No, it's not at all concerning. Those staff will work as efficiently and effectively as they can. And how many people turn up is actually not their issue. They've got to deal with the people who are there. It's other people's issues to work out if they have to stand up more clinics or extend hours or bring in more staff. So no, of course that doesn't concern me.
How much notice were hospital management given before the statement went out to the media regarding the Victorians?
So I alerted our Hospital and Health Services, and the Director General did as well, before Christmas, saying that there was a real risk that any day we would need to stand up additional testing and to be prepared for that, and they all were. They all had surge plans, they all had processes in place. And then I met with the Chief Executives again on Thursday morning between Christmas and New Year to again say things are escalating. I'm concerned we may need to stand up more testing. So they've been kept aware, as you'd expect, all the way through. Plus, our State Health Emergency Coordination Centre meets every single day with the hospital and health services and talks to them about the emerging issues. So we have a lot of communication that goes on.
Back on the cricket, Dr. Young, India is saying that they have to quarantine at all levels. Do you think is that an option on the cards, or do you think there will need to be those?
That's a discussion that Cricket Australia will need to have with the players. If they come to Queensland after having been in a declared hotspot, they will have to quarantine.
So Queensland won't bend at all?
No, we can't. They're coming from, if they come, as I'm saying, if they come from a declared hotspot, and at the moment all of Greater Sydney is a declared hotspot, then, as no different to anyone else coming from a declared hotspot, they will have to quarantine. Thank you very much. Thank you.